Hi, our topic is antiemetics.
The action of this drug stops the chemoreceptor trigger zone. This is a nerve fiber that sends signals to the vomiting center in the medulla. Antiemetics also stop the dopamine and acetylcholine in the brain. This drug can also target serotonin receptors at the CTZ or the chemoreceptor trigger zone and at nerve endings in the stomach. So this medication can be used to cut out nausea and vomiting, or it can be used for irritable bowel syndrome as well.
I'm Grandma Diane. I used these drugs during my radiation therapy that affected my GI tract. I'm Angelique. I used antiemetic medications during, before, and after I was administered anti-neoplastic drugs that induce a high degree of nausea and vomiting. I'm Lucas. I used these medications right after I had my surgery when I was recovering from anesthesia. Hi, I'm Diana Thomas. I used antiemetics while I was pregnant for hyperemesis. I'm Mr. Jacob Thomas. I used antiemetics right before surgery to prevent vomiting during surgery. Antiemetics are drugs used to treat nausea and vomiting, usually caused by other medications. They can also be used to treat motion sickness, vertigo, stomach flus, and infections.
Hey, I suffer from motion sickness, and my family and I decided to ride on this cruise ship. Wasn't the best decision ever, but ever since I took my antiemetics, I haven't felt the need to vomit at all. I feel so much better. Well, if we ignore the side effects of like slight drowsiness, dry mouth, nasal congestion, hypotension, hypoxia, and some diarrhea, I'll admit that. So far, I'm feeling great. Hey, I'm her brother. I only threw up twice before I took the antiemetic medications, and I haven't thrown up once after. Sure, I felt some things, here and there. I might have had swelling in my mouth or stomatitis. There might have been occasional headaches, fatigue, some mild fever, but these medications sure do work mighty fine. I don't feel too good, but ever since I took my antiemetics, I felt so euphoric. I guess other side effects I might have had were like abdominal pain. There might have been some constipation, asthenia, vertigo, occasional psycho hallucinations, but like not anything too serious. But I might have also had like somnolence. I think that's what it's called. I'm not really exactly sure. But, I feel fine. I am just fine.
Hi, my name is Nurse Emily, and I'm going to be presenting some contraindications and precautions for antiemetic medications. So first we have contraindications. We have hypersensitivity. We have severe CNS depression. We have cardiac conditions such as heart block or prolonged QT intervals. We have bone marrow depression. We have blood dyscrasia, Parkinson's disease, and we have severe liver or cardiovascular diseases. It is not recommended for pregnancy or lactation, nor is it recommended for young children. Now we're moving on to precautions. We have severe nausea and vomiting. We have brain tumors, appendicitis. We also have intestinal obstructions. We have drug toxicities, and we also have glaucoma. And then we have renal or hepatic dysfunctions. We have hypertension, sleep apnea, epilepsy, and we have older men with possible prostatic hypertrophy. Lastly, we have cardiac conduction problems or electrolyte imbalances. Thank you.
Drugs that interact with antiemetic drugs include CNS depressants because they increase the risk of sedation, antihistamines because of the increased adverse cholinergic blocking effects, antacids because they decrease the absorption of antiemetics, rifampin with 5-HT3 receptor antagonists because of the decreased effectiveness of the 5-HT3 receptor antagonists, and lithium with chlorchlorozine because they increase the risk of extrapyramidal effects. Thank you. I was the nurse caring for Mr. Thomas in the hospital, and I had to give him a nursing diagnosis. For his nursing diagnosis, I gave him ineffective health management related to inability to take oral forms of medication, as evidenced by a patient was having trouble swallowing the pill. The second nursing diagnosis I gave him was impaired nutrition related to impaired ability to ingest and retain food and fluids, as evidenced by I feel like I have to throw up. Thank you.
Hi, I will be performing patient teaching. So a patient who is taking this medication should avoid driving or performing any other hazardous tasks because this medication can affect their perception and how they will do stuff. Another teaching point is they should avoid alcohol while taking this medication because it can have an interaction and cause a more sedative effect. The next teaching point is the patient should notify their doctor if their pain increases or if they experience tarry stool, and if their stool or if their vomit looks like coffee grounds. They should notify their healthcare provider immediately. Lastly, you should teach the patient how to administer suppositories correctly. You should teach them not to force it in, and you should also teach them that they should hold in the suppository as long as they can so it can be effective.